We're going to talk about stopping medications, something that makes me anxious, something that makes my patients anxious, something that makes their families anxious. So we have to remember what happens when we start an SSRI. We're all familiar with the initial process, the increase in serotonin, the activity at our 5-HT1A receptor. We get a decrease in firing frequency acutely as we block that serotonin transporter. And chronically, what happens is we get a rebound in that firing frequency and ultimately a decrease in serotonin release. However, what we now have is an uncompensated system in which we are now super sensitized to the effects of endogenous serotonin. And that is one of the things that gives rise to that jitteriness, potentially those flu-like symptoms that accompany many of our patients with withdrawal. So in terms of stopping antidepressants in anxiety disorders, the most important aspect is time. Time will help us answer the question, is this withdrawal or is this worsening of the anxiety disorder? And here you see this really laid out in terms of time of onset, in terms of duration. The other thing that's really important here is in terms of assessing the response to restarting the medication. If it's withdrawal, it will improve very quickly. If it's recrudescence of the anxiety, it will follow the typical time course. Also, as many of you got in the pretest question, those cardinal symptoms of withdrawal are a really helpful factor to distinguish. All right, so how do we actually do this?